Hey everybody, Dr. Leo Krawetz, Healthy Feet Podiatry, of course. I've got a patient here that needs cortisone injections. So I did a video before about all the things that you can do at home and everything you can do before getting a cortisone shot. But this patient has been doing the stretching. He's been icing it. He's been wearing arch supports, not orthotics yet, but he was doing great for several months. And all of a sudden, a few days ago, started to hurt again first thing in the morning. A lot of things can bring it on, like increased weight on the feet, increased time on your feet with not enough arch support, or in his case, maybe because he didn't have custom orthotics. Regardless, it's to the point he's having trouble walking. So I'm gonna help him, and I'm gonna help him with a nice long needle. Actually, a couple of them. It's not that long, it's not that big, and he's laughing right now because we're actually exaggerating. But if you look, the needle is actually only that long. It's 1.5 inches. But it's a 27 gauge needle, so it's thin. And when you look at it, you can see how thin it is, that it actually doesn't hurt as much. It's almost like the size of an acupuncture needle, which I think is probably a 31 or 33 gauge needle. The higher the number, the thinner the needle. This is 27 gauge, so we can actually push steroid through it. So I'm gonna go ahead and give him the injection. And what I'm gonna do is I'm gonna put the injection above the plantar fascia. I'm gonna do 2 injections for him because he has pain right here where it attaches, correct? Okay, and then right in the middle of his heel, which is where you form a heel bursa. Bursitis is an inflammation of a little sac that forms in the middle of the heel, and that sac swells up. So I'm gonna first do the one above the fascia, okay? And what I do to inject it is I spray him with ethyl chloride. I use a lot of this stuff. It's a pretty expensive product, but it's called a refrigerant, which means it freezes the skin. So when you do this, the nerves are telling his brain, hey, it's cold, it's cold, it's cold, it's cold, it's cold. So it kind of tricks him. So when I put the shot in, and I'm putting the shot above the plantar fascia, he's not going to feel it as much. Do you feel that up there?
No.
Okay, so to him, it just feels like it's really cold. So it's great. He didn't even flinch, no problem, okay? So that one's done. And I went above the plantar fascia. So all that medicine is distributed this way, above the plantar fascia, but mainly right here where the plantar fascia attaches. The second injection is a little different. I'm actually going to go into the bursa. The bursa is in the fat area, so that's between the dermis and the bone, pretty much. And I'm going to go right into it, and I can feel it, and it will actually let me, because of the, it's not super solid, so I'll be able to push the medicine right through. This one, you can imagine, if you stepped on a needle like this would hurt like crazy. But because I'm spraying him, it's kind of going to take the sting out. But I do have to put it in pretty quickly. So I'm going to shove it in there real fast. But he's not going to know anyway because he's going to be frozen. I'm watching the skin. This one I do a little bit longer. You see how it's freezing? It's like icicles, okay? And when I do it and I put this in, you can see it's harder to get the needle in, but did you feel that stick at all?
A little bit.
A little bit? Okay. But not even close to what it would be. His reaction would be pull the foot away if I hadn't sprayed that. And you can see I'm pushing the medicine in there. I can feel where I'm at. I've done this so many times by feel. And I also can look at the needle and see too. So now I'm going to pull that out of there. And this should be great. Again, you can. The reason I do the 2 injections is because he's going to get a lot of relief. A lot of the pain's coming from the insertion of the plantar fascia and the middle of the heel. So he's going to be feeling really good. I'm going to show him the needle to scare him and make him feel like he's really brave. Look what went in your foot. Can you believe it?
Yes.
I can't believe it. Anyway, he's going to be doing great. I'll put some Band-Aids on him. He actually can do whatever he wants today. He can do his regular activity. The whole bottom of his foot won't go numb, just a little bit of the area here. We just don't want him doing any pounding on the foot. This is very helpful. People ask, how long does it last? It lasts, your body gets rid of this medicine in 48 hours. So it's like putting water on a fire. It either works or it doesn't work. But in most cases, most people get 75 to 100% relief for a while. So 2 weeks from now, he'll come back in. He's going to tell me, is it doing well? I know 2 days from now, it's out of the system and most likely he's going to be doing well. But I want to see, did it get re-inflamed? If he had orthotics, that's helpful, but even with his over-the-counter arch supports, it's still going to give him some help, and wearing sneakers and not wearing backless shoes is also going to be helpful. So we'll show you some more treatments for it in another video. If you like what you see, subscribe to the channel, like us on YouTube, watch us on Instagram, and we'll see you later. Thanks.